Cardiovascular Pharmacology, Class 3 Antiarrhythmics, potassium channel blockers. All right, so for our Class 3 antiarrhythmics, this is probably one of the most important ones. They talk about amiodarone in this specific Class 3 one, okay? And once again, these are our potassium channel blockers, okay? So we talked about how Class 1 was sodium channel blockers, Class 2 was our beta blockers, and now Class 3 is our potassium channel blockers, okay? First and foremost, the drugs that we're gonna be talking about is amiodarone, and then the Tilide, so Tilide, if it ends in Tilide, then you know you're dealing with it, as well as sotalol. Sotalol, as you notice, it ends in LOL, so it has to be a beta blocker. So sotalol acts as a antiarrhythmic class 2 and antiarrhythmic class 3, okay? So keep that in mind. Now, amiodarone, out of all these, is the most important one, but you have to know all these. Similar to class 1C, class 3 drugs are rhythm control. So that means that you know that you're going to be dealing with the cell action potential graph for the cardiac myocytes, not for the SA and the AV node, because you're dealing with rhythm control, not rate control. The mechanism of action here is that you're going to increase the duration of the action potential by increasing your overall ERP and your QT interval, because you're blocking the potassium channel, right? So whenever we block the potassium channel, we're going to be elongating that phase 3 portion, okay? Guess what? Whenever we have potassium channel blockage, what's our biggest risk factor that you have to look for? Exactly. Torsades de pointes, okay? So our sotalol, our Tilides, they all have the risk factor of torsades de pointes. Now, amiodarone, on the other hand, although it is a potassium channel blocker, it acts via class 1, class 2, class 3, and class 4. It has all activity of all antiarrhythmics, okay? So it's a very, very strong, potent type of drug, okay? And we can use it for so many different things. And they use it a lot of the time in the hospitals, but it's so toxic. So there's so many adverse effects that they want you to know about amiodarone, okay? It's like not even used in other countries, but we use it still here just because of how great the effects are. However, the adverse effects are very scary. So we have to know the adverse effects of amiodarone. Okay, first and foremost, you have an increase in PR interval, an increase in QRS duration, and an increase in QT interval when you give patients amiodarone, okay? That all makes sense, okay? Especially with all class 3, it's very odd, but amiodarone, you have an increase in PR interval because it acts as a class 2 and a class 4, right? You have an increase in QRS duration because it acts as a class 1, right? And you have an increase in QT interval because, once again, a potassium channel blocker. But there's no risk of torsades de pointes compared to the other drugs like sotalol and the Tilides, okay? Now, the other risk factors. Amiodarone causes pulmonary fibrosis, hepatotoxicity, and a potential risk of hypothyroidism or hyperthyroidism, both of those, okay? So that means that we have to check our pulmonary, okay, our liver, and our thyroid function tests. So PFTs, LFTs, and TFTs all have to be checked when using amiodarone because of those three things that I said: pulmonary fibrosis, hepatotoxicity, and hypo and hyperthyroidism, okay? Next, it acts as a hapten, so it can be corneal deposits. You can get blue-gray skin deposits, which causes photodermatitis. And you can also have neurological effects with constipation and cardiovascular effects with bradycardia, heart block, or heart failure. But what do I care most about? I told you PFTs, LFTs, TFTs, pulmonary fibrosis, hepatotoxicity, and hypo or hyperthyroidism, okay? So remember that amiodarone overall is going to be rhythm control, right? But it has class 1, 2, 3, and 4 effects. So it's also lipophilic. So once again, if it has a class 2 and class 4 effect, it's going to increase our PR interval, and that's what it does. If it has a class 1 effect, it's going to increase your QRS duration, and that's what we see happen. And it has that specific potassium channel blocker effect, so it's going to increase the QT interval. But it has a rare risk of torsades de pointes compared to the other ones, because the other ones are specific potassium channel blockers that act solely for class 3, okay? So be aware of that. Once again, you're going to use it for atrial fibrillation for rhythm control, and you should be good to go.